The cervical cap is a small, flexible cup-shaped device made of soft silicone or latex that fits snugly on the cervix, where it is held by suction, similar to a menstrual cup. It prevents pregnancy by creating a barrier that blocks sperm from reaching the egg. It is most effective when used together with a spermicide, such that any sperm that attempts to get to the cervix is destroyed before it slips through. The cap comes in different sizes. The small cervical cap is recommended for women who have never been pregnant. The medium cervical cap is recommended for women who have had an abortion, miscarriage, or C-section. And the large cervical cap is recommended for women who have given birth vaginally. The cap is most effective for women who have never given birth. With perfect use, it has an effectiveness rate of 91% for women who have never given birth, and 74% for women who have given birth. Fertility comes back as soon as the cap is taken out. You can insert a cap at any time, even up to 42 hours before sex. Before inserting the cervical cap, wash your hands thoroughly to maintain cleanliness, and then find a comfortable position for insertion. This can be on a raised leg, squatting, or sitting on the edge of a chair. Apply a generous amount of spermicide inside the cap and around the rim before insertion. Fold the cap in half so that it forms a U-shape with the spermicide on the inside. Gently insert the folded cervical cap into the vagina, aiming toward the back of the vagina until it reaches the cervix. Once in place, use a finger to push it up and ensure complete coverage. Run a finger around the edge to ensure it is well placed. To ensure effectiveness, the cap should remain inside for at least 6 hours after sex. While inside, the cap can be used more than once. Just add more spermicide before every round of sex, and you are good to go. You must, however, not have the cap in for more than 48 hours, and don't use it during your period. Doing so might cause toxic shock syndrome. During removal, wash your hands and find a comfortable position. Insert a finger into the vagina and locate the cap. Release the suction by breaking the seal between the cap and cervix. Grasp the rim of the cap, gently rotate it and pull it out. After removal, clean it with mild soap and clean water. Allow it to dry for future use. This method is non-hormonal and can be used by females who cannot use hormonal contraception options. It is reversible and allows you to get pregnant immediately after you stop using it. It is a female-controlled method and hence allows sexual autonomy, and you can insert it hours before vaginal sex to allow for spontaneity. Although it is not cheap, it is reusable for up to 2 years, making it a cost-effective option. Some of the side effects associated with using the cervical cap include allergic reactions to the materials used to make the cap. It needs to be in place every time you have sex and may not be a good option if you have sex often. It may be pushed out of place by a large penis, heavy thrusting, or certain sexual positions. It may increase the risk of urinary tract infections due to the pressure on the bladder. The cervical cap may also cause an increase in vaginal discharge, which should not be a concern unless it is accompanied by other symptoms such as itching, a burning sensation, or an unusual odor that may indicate an infection. If any of these symptoms occur, it is important to seek medical advice as soon as possible. The cervical cap will not protect you from STIs, so it is important to use a condom to stay safe. Learn more about the cervical cap and other contraceptive methods by visiting findmymethod.org.